Welcome to the November 8th, 2021 Grafton Board of Health meeting. As a preliminary matter, this is Karen Gwiazdowski-Govin, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present can hear me. Members, when I call your name, please respond in the affirmative. Dan Finn.
Dan Finn, present.
Austin Magnan.
Austin Magnan is present.
Bill Muller.
Bill Muller here.
And then Jennifer Maynard, who I know is trying to log in. So I'm sure she'll be with us shortly. Then staff and anticipate speakers on the agenda. When I call your name, please respond in the affirmative. Nancy Connors. Looks like I'm going to do the. She might be off. And then Colleen Bolin from the Alliance.
Hi, everyone.
Hello. All right, is Julie joining? I know when I talked with her on Friday, she wasn't sure.
I don't believe so, but I can pass back any questions that you have to her.
Thank you. All right, so I'd like to open the meeting. Can I get a motion to open the meeting?
This is Dan Finn. I'd like to make a motion to open this meeting.
This is Austin Magnan. I will second that motion to open the meeting.
And then all in favor by roll call.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Karen Gwiazdowski-Govin, aye. All right, good evening again. This open meeting of the Grafton Board of Health is being conducted remotely, consistent with the Act extending certain COVID-19 measures adopted during the state of emergency in Massachusetts. This act includes an extension until April 1st of 2022 of the remote meeting provisions of Governor Baker's March 12th of 2020 executive order that suspended certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted to the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. And there are no public hearings scheduled for this evening's meeting. For this meeting, the Grafton Board of Health is convening by video conference via Zoom, as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and that you take care not to screen share your computer because anything that you broadcast could be captured by the recording. Any supporting materials that have been provided to the members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Prior to us turning to the first item on the agenda, allow me to cover just some basic ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any topics and any speakers associated to them on the agenda. After the speakers conclude their remarks, I will ask if any of the board members have any questions, comments, motions for that topic. Then obviously, please remember to mute your phone or your computer when you're not speaking. And then please remember to speak clearly and in a way that helps generate accurate minutes. For any responses, please wait until I, the chair, yields the floor to you and then state your name before speaking. And then if there are any votes taken during this meeting, they will be conducted by roll call vote. So with that, let's jump over to the first topic on the agenda, which is the Alliance update. Colleen?
Hi, everybody. This is Colleen. Everyone should have gotten the email of the Board of Health updates for the month of November. So I won't read all of them as everyone can read them, but I just want to highlight a couple things for you. And then certainly I can answer any questions that you have. First off, tomorrow is the launch of our new 2021 Greater Worcester Community Health Improvement Plan. So this plan was originally supposed to come out in 2020. So we do a community health improvement plan every 4 years. It was supposed to come out in 2020, but with COVID, we got very much delayed. So all of the strategies in this new chip come from hundreds of thousands and thousands of surveys that were done in the Alliance communities as well as the city, also focus groups that were done, key informant interviews, and really taking a deep dive into the data that was collected on our 2018 community health assessment. So again, the process, just for a quick reminder, is we start off doing a community health assessment, which we call a CHA. That gathers a lot of data from not just the city, but your communities as well. Because again, the community health improvement plan is not just for the city of Worcester, but it includes all of our Alliance communities as well. So all of your data is included in our community health assessment. And then once you've done your community health assessment, you take that data, you analyze, synthesize the data, and then you spend a considerable amount of time working with the community to identify what are your priority areas, and then what strategies you want to put in place to help move the needle on those priority areas. So the data came out in 2018, which would inform this current chip, which again was supposed to come out in 2020, but got delayed because of the pandemic. And so this is really an opportunity tomorrow to show the community the plan and the strategies and the priorities for the first time. And then over the next 4 years, work on identifying what strategies different community organizations want to take on and want to take the lead on. It'll be an opportunity for our staff to come and meet with you at an upcoming meeting to look at the data specific to Grafton, look at the strategies that have been identified, and look to see where we can piece in different organizations or the Board of Health in Grafton on specific strategies. So could be strategies around mental health or health equity, could be strategies around tobacco. There's a whole host of different strategies in there, and we'll really be looking for your input as well as community organizations in the town and the community in general to really help identify some strategies that as a community and as a town you would like to try to move the needle on. It's not one size fits all, so certainly not every strategy would be applicable to the town of Grafton. And within each strategy, the means of trying to move the needle is not one size fits all, right? So Worcester and Grafton may pick the same strategy, but the way that we would go about it in Grafton may be completely different than the way we would go about it in Worcester, right? It's very dependent on what the data says and what you have for community buy-in, community organizations, and interest within your community. So we're very excited to finally be able to launch this new improvement plan. Karen Clark, that is, sent out, I believe, to everybody the link with how you can log on virtually. I believe it's at 12:30 tomorrow, 12:15 tomorrow. But we really encourage folks, if you have time, to join and to be able to learn a little bit more about this upcoming chip. If anyone doesn't have the link, please let me know and I can forward that to you. But this will be a great kickoff to really become familiar with what a lot of the strategies and priorities that were identified, and really that were identified by the community, right? This is not a top-down approach by any means. This is from the bottom up and what the community says and what it's looking for and what it says within the data. So please let me know if you don't have that link and I can provide that for you. But we're excited for the event tomorrow, and we're more excited to be able to have some more targeted conversations with the board in terms of what strategies and priorities are out there and what may be of interest to you guys. Does anybody have any questions on the chip before I move forward? All right, so that was just one thing that I wanted to highlight. Another exciting piece of news that I wanted to highlight is that MICA who works alongside Julie in our environmental health team. He has been spending the past couple Mondays doing a comprehensive Title V inspector training. So previously, Julie and Phil were the two folks that led Title V within the Alliance and had the required training and certification for Title V. Since Phil has retired, it's just been Julie that had the proper training and certification. So we're really excited that Micah is getting trained up. I believe he actually takes his exam in a couple weeks, and then we'll have another person on board that can support Julie with some of the Title V work. So we're very excited for that, to be able to have Micah trained up and to be able to support Julie with Title V. Also, as you have all probably heard at this point, the Pfizer vaccine is now approved for the 5 through 11-year-old age group in a different dosage, but nevertheless, it is still approved and is now authorized to be administered in the state of Massachusetts, in the country, in the state of Massachusetts. Karen Clark sent out an email probably last week as a follow-up email to an email she sent a couple weeks ago, gauging what town's interests were in holding pediatric clinics, as well as booster clinics for the adult population. I did check in with her and Pat today, and I take that back. The email may have actually come from Pat Bruckman, not Karen, but really looking to see, is the town interested in holding pediatric COVID clinics? That's something that, we would ask that the town talks with the school department to see if that's something that's, of interest. And certainly if it is, we can work and collaborate with the schools to offer clinics on site, or we can also work with the school department and the Board of Health to make a request for a mobile vaccination bus. So this came out as well when the 12 to 17 age group became eligible. The state is utilizing a vendor, and you can actually request a vaccination bus, I think, or van, to come on site. I don't know the vendor off the top of my head that the state uses, but they will come on site to school and vaccinate that way. I'm not entirely positive, but I believe that was done in a couple of our Alliance communities, that the van came directly to the school and provided vaccinations for children, the 12 and older that were interested. So that's also an option. So I'm throwing that out there. I don't know if any of you have had any discussions either with Evan or with anyone from the school department. We have not heard anything as a reply on our end, but please let us know if there's interest in town on pediatric clinics, and we can look into that and do some kind of fact-finding logistical work with you to see if the state vendor's an option, or, like I said, us coming in and being able to provide a couple clinics like we did with the flu clinics. That's an option as well. So let us know if and when you think that's something that's of interest in the town, and we're happy to provide any support that we can with that. I would also say, in terms of booster shots for adults, certainly it's widely available, right? You can get it at pharmacies, you can get it at a lot of places. But again, if that's something in your community, we actually did 2 booster clinics in the town of Shrewsbury last Friday and Saturday, and it was for town employees and school department employees. And I believe Amelia said they did, between the 2 days, about 150 booster doses. So again, that's something, if it's of interest in the town to do a booster clinic for school staff, town staff, we can certainly do that as well. Just let us know. We can start to do some planning around that.
Dan?
This is Dan Finn. Colleen, it's been in the news about Worcester already providing some pediatric immunizations. How are they handling it, and who's staffing that?
So in the city of Worcester, our Commissioner of Health and Human Services, Dr. Castile, has taken the lead working with the schools. She already takes the lead on providing flu vaccine every year to the schools within the city. So she's been taking the lead to not only offer flu vaccine, but also COVID vaccine. It's a pretty big undertaking. So it's 5 schools per day for 10 days. And today was day 1. So I don't have the count on how many they did today. I know Pat said it was really hit or miss. Some schools had 50 kids, other schools may have had 1 kid, right? So it was pretty hit or miss depending on the school. But we were able to secure vaccine, and certainly Pat actually just put in order for more. So the vaccine is available. It's certainly not an issue like it was back in January of 2021, right, where it was hard to come by the vaccine. There's in the cities, it's a different beast, right, because there's so many schools. I think, in a community like Grafton, it would be a little bit more manageable just because it's a smaller population, less schools to contend with. It would only, I think, would it be 2 schools that would encompass, right? Because you're split up, right? Like kindergarten through first or second, I think, right? And then
and that's 2 because that's North Grafton Elementary and South Grafton Elementary.
Okay.
And then, of course, I'm trying not to put on what was the school system when I was a kid in Grafton. It's not the same anymore.
Nevertheless, that is certainly something that if there's of interest in the town, we can certainly do it. I'm sure we'll have a lot of lessons learned from how it goes in Worcester over the next couple weeks. Like I said, it's only day 1, so I haven't heard a lot one way or the other, but certainly over the next couple weeks, it's an undertaking in Worcester.
Dan?
I think, this is Dan, I think the mobile option is pretty interesting. But Karen, do you know if Nancy or anyone has been in touch with Jay Cummings, or we heard from the superintendent of the schools on his opinion on this?
I know I haven't heard anything. I did see on Facebook, for what it's worth, but I'm pretty sure it was actually a response from Jay Cummings. So I trust that by a lot more, rather than any type of hearsay that you might get from third plus parties. That sounded like, and don't quote me on this because I don't have the exact post in front of me, they were looking or working with DPH and a pharmacy. I think it was a more independent pharmacy, not a chain, to try to schedule clinics either during school and or after school.
That's right.
But I don't know of, unless Nancy had gotten something. I know I wasn't reached out to about it.
Yeah, that's right. As I recall, it was Bouvier Pharmacy in Marlborough. And so I guess it would be, Colleen, probably 10 days or so. I don't know if it'd be before Thanksgiving to get something rolling in Grafton if the Alliance helped out. Because your personnel are going to be pretty busy for the next at least a week, I would think.
Yeah, so in terms of the scheduling piece, what we would probably do is if it's of interest in town, whoever you feel on your end, any Board of Health members, school department that needs to be involved, I would pull in Pat Bruckman and Amelia Houghton on our end on the scheduling piece. I don't want to speak for them in terms of scheduling and timeline, but certainly it's a conversation that we can have in short order if it's what you're interested in.
Karen?
Hey, there she is. Been trying to get Nancy unmuted.
Finally. No, I have not heard anything from the schools. Nothing.
I didn't think you had.
I do know, and I got the numbers from Pat, and I think she wrote them in here as well, that the flu clinics that were held at the Grafton High School and the middle school on October 27th, 45 students were vaccinated. And then Pat just told me that the Millbury Street Elementary School clinic is scheduled for November 17th. So those are coming up, or that one's coming up shortly. Who would be, do you want to, I don't know, in terms of the reach out to the schools, is that something, would you want to reach out to the schools? Would you want us to reach out to the schools? We're happy to take your lead in terms of how you want to handle the pediatric rollout.
I mean, we can reach out, one of us can reach out to see if there's interest. I have no clue. Like I said, it was a Facebook post. I have no clue. They could be like in final stages, like locked up, I don't know, contracts, whatever takes place, or they could be just exploring it at this point in time.
Okay. All right. Well, just let us know. Like I said, we're happy to support. So just let us know.
Thank you.
And I think that was all I wanted to highlight out of the report, but certainly if anybody has questions on other things as well, I'm happy to answer.
Dan?
Yep, I've got one or two more. One comment is that I think that's great that Mike is being trained in the Title V stuff. Just looking at the list that we got recently, about it's almost 30 different various inspections that apparently Julie did most, or if not all of them. So that's great. I did have one on the food inspections. I just had one question, maybe two, but anyway, about there was a Cumberland Farms with a number, and apparently that was some kind of a food issue. Do you happen to know which one of the three Cumberland Farms that is?
You know what? I don't, but while we're still on the call, I'll text Julie and see if she can just text me right back and let me know what address that Cumberland Farms is.
What the issue was. That.
Yep.
I don't know if it's necessarily an issue, Dan. It just is listed. The only Cumbies I see listed is under just food inspections.
Okay, it just seemed like it was highlighted, so maybe it was not even a violation.
It's not highlighted. It was just misspelled. It's Word telling us.
Oh yeah, that's right. Okay, so
like, no, it's just Word telling us.
Okay, so never mind, Colleen. That's
okay.
Apparently not an issue.
Did you have something else?
Yeah, just that there was some communication from Julie about the odor complaints in North Grafton, and it sounded like it was what I saw of the letter of response from the CEO, or David was his name, that they certainly seem to realize it's a concern, and they seem to want to mitigate the situation. They have a plan, and I'm assuming that's a new company ownership of what was previously Troiano's. Is that true, do you think?
That was my understanding as well.
Okay.
Yeah, they own the facility now and fixed it up.
And again, just for my opinion, I thought that that was a very good response, and it sounds like they're serious and sincere about taking care of the situation.
And I can say, like, keeping an eye on Facebook and being up there Saturday, not up at the place, but very close by to the facility. I don't know if they run on Saturdays normally, but regardless, I haven't seen any more chatter on Facebook since it happened, really. And then there was definitely, I didn't smell anything when I was in that general area on Saturday. Not saying, it sounds like you said, Dan, based on their response, they want to be a good partner with the communities around and not have something like that happen again.
It sounds like they were going to notify the Board of Health when they try and do that batch again. I don't know if maybe we should reach out to them and just recommend that they also maybe, I don't know, do some door inserts or something into the neighbors in the area so that they know that they're testing it, so that it doesn't create kind of alarm, because now people know what it is, but you don't really know if there's something else going on in your community. So they might want to be a little bit more proactive, not just with the Board of Health, but the neighbors as well.
And I also, the only chatter I saw, like kind of like spinning off at the end once the letter was published by the town, was there were a couple people I saw on Facebook that were questioning what said deodorizer process, whatever that they're going to install is. In other words, I think people were wondering, is it something chemical? Is it a
Right.
rubber that doesn't have chemicals and it just somehow scrubs the air? So once that time comes, I think it would be worthwhile for the company or someone, even if it's the town, with a follow-up to say more about what this new process is beyond that they're going to be testing it out, and hopefully it works fine this time. Because I did see a couple people out of all the comments question, okay, that's great, but what is it now that we might end up breathing in?
Absolutely. I agree, Karen.
One question, Colleen, that I had was, do you know if there's been an actual hard frost that would lift the whole Tripoli West Nile?
So I have not had or seen any communication from Mass DPH signaling that we are in the clear. That being said, I remember from, I think 2 years ago, we kept asking the state when we had a lot of Tripoli cases, well, tell us when there's, when we've had a hard frost. And they basically said, like, we don't, right? Because it's very specific on where you are. So I have not heard any blanket statements from SDPH saying, that overall in the state of Massachusetts, we've kind of surpassed the time of year where it's more prevalent. So I'm unclear. I mean, I know presumably I've had some frosty days at my house, right? But we haven't heard anything yet saying that, officially kind of the season's over.
I didn't think so, but I figured while we were on, we might as well ask.
Yeah, absolutely.
All right. Is there anything else for Colleen from the board members? All right. I'll take that as a no. All right. Well, thank you, Colleen. Feel free, obviously, to stay on, but thanks for the update and everything. And I doubt I'll be able to attend the CHIP meeting tomorrow because of work, because I know I have meetings at the same time, but I hope everything goes great.
Thank you. We'll be in touch after with follow-up. So there'll still be plenty of time to discuss it locally with the board.
All right, so next topic is COVID-19. So in town, let's see, as of today, we've had a total of 1,480 confirmed positive cases since we started tracking back in early 2020. The number of cases this week was, well, this past week, I should say, not this week, we're just starting this week, was a few cases higher than we had seen for totals in recent weeks. I think we had a total of 30. I know there was one day that drove that total up higher. It was a day, I think we had 13 cases. And then like the rest of the days were like two, maybe 3, 1. So it was kind of an anomaly when you look at, what we had been trending at from a town for like a daily case count. I know, the county and all the surrounding areas, everyone's still considered high risk. As we continue to say to everyone, please continue to exercise precautions, mask wearing, social distancing, frequent hand washing, because we're still not out of the woods yet when it comes to this. And the Delta variant is still out there. Let's see. Is there anything on the data before we jump to vaccination efforts? No, all right. So vaccination efforts, obviously we also, besides strongly recommending everyone continue to wear, masks and social distance, et cetera, and continue the precautions, we also continue to strongly recommend as a board that all individuals who are eligible to get vaccinated do get vaccinated. And then the state still has their links up with information regarding the COVID vaccines that are available, where you can find vaccine appointments. As Colleen mentioned, the FDA authorized and CDC has also recommended that children ages 5 to 11 now get vaccinated. Currently, the only vaccine authorized for that age range is the Pfizer vaccine, and it is a different dose than what adults and older children are getting. Then we've talked about previously that there's also authorizations for certain populations to get COVID vaccine boosters. And then that also the FDA and CDC had recommended that certain individuals with certain immunocompromised status receive an additional dose of an mRNA vaccine, so a third dose as such, after their initial 2 doses. And all that information is, you can go to the Board of Health website. Each time one of these authorizations or approvals has come out, we've put information up. You can go to the CDC's website, Mass DPH's website. And then as Colleen was mentioning, there's, from a booster dose perspective, et cetera, we are not in the same place we were in January of 21, where they were hard to come by. There's definitely appointments available, whether you need a first dose of a vaccine, a second dose, a booster, or pediatric. There's definitely availability out there at a variety of locations, such as CVS, Walgreens, et cetera. Any questions or comments from the board members before jumping down to mitigation efforts for COVID? Dan?
Just a quick question for Nancy. Nancy, have you gotten any phone calls in the office from eligible folks that are not able to find a booster? Or from the Council
No,
of
we haven't.
Aging?
No, I have not received any.
Okay, thanks.
All right, so mitigation efforts related to COVID. This we put on here as a continuing topic that we've been discussing the past 3 meetings prior, around whether the town wants to put any additional type of mandates or orders in place regarding COVID mitigation efforts, such as mask wearing indoors. So I just wanted to keep this as a topic, obviously go forward at this point, since we are far from being done with the pandemic. So I just wanted to open it up to the board members if there is any discussion further on this or this evening regarding any of those mandates or not. Dan?
I know we're keeping an eye on the trends of positive cases, and they have gone up. And I know, Jen, you mentioned that. Again, 30 is still 4 per day. And I think we just have to be vigilant and watch it. If there's a bona fide spike, to me, that would be, I don't know, 45 or 50 in a week or something like that. It might warrant, a couple of weeks from now or something, an emergency meeting, an emergency order or whatever to consider. But in my opinion, I think we just have to keep an eye on it closely for the next couple of 2-3 weeks. I don't know what anybody else thinks about that.
Yeah, thanks for that, Dan. That's kind of what I noticed. Thanks, Karen, for drawing attention to the one particular day. But just noticing the 2-week climb, I think it would be a good idea to say, as you said, like if we jump to 50 in a matter of a few weeks, we might want to have just a target number in mind where we might want to have a interim meeting, just so that we're sort of not chasing it after one of our meetings, and then we're going into the holidays, and I know we'll have to be doing, year-end sign-offs and things like that.
Karen, this is Bill Muller. I think one of the issues with these mitigation techniques is how do you enforce them and how do you get people to comply with them? My own unscientific survey of going into stores is that about half the people are wearing masks, even if there's a big sign in the entryway to the store saying you must wear a mask. There's still not improved compliance. Now, I think certainly if we had evidence of a definite upswing, and of course we're moving into a high risk time of year because people are going to be indoors. We have family gatherings, we have, holiday festivities and things of that sort. And so I think it's still kind of an unknown exactly what's going to happen. I think we're encouraged by the fact that we have a high vaccination rate, and hopefully that will put us in good stead in terms of the risk of another spike. Certainly we're in a much better position than what we were last year at this time. But I think the issue would be, how would you enforce it? How would you, I think to some degree you're going to be putting merchants in the crosshairs of trying to enforce something that obviously people, for a variety of reasons, have very strong negative feelings about.
I guess I would just say to that I don't think there's anything that says that if we adopted or recommended any of the mitigation strategies, it would have to be all. We could even, as I mentioned in my email, we don't really know where any of the spikes might be coming from. So we could look at it as, asking employers to report. I know that comes with administrative barriers. But, we wouldn't have to necessarily do all if we did some. That was kind of full circle back to our beginning discussion on this. I agree, we're certainly in a different place than we were, but, just trying to stay ahead of the game here.
Any other comments? If not, we will keep an eye on it. Obviously, we'll have it for definitely the next monthly meeting, but then, keeping an eye on where the data is going. Like we said, we can schedule something in the interim and not wait the whole month if we're seeing a trend going in the wrong direction. All right, next topic is nominating Jay, I apologize if I don't pronounce it right, Huson or Hassan as animal inspector. So we did there was annual nominations back in April. So this is just one based on some things that have changed since then. So with the nominations, it's typical motion, second, any discussion, and then a voting. Dan?
Yeah, I'd like to make a motion to nominate Jay Husson as the animal inspector.
Is there a second?
This is Bill Muller. I second that.
All right, and then we'll do a roll call vote.
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
Jen Maynard, am I able to abstain? I don't know anything about him.
Yeah, you can.
Thank you.
Karen Gustowski Govin, aye. All right, so motion carried, passed. All right, and then Nancy, I know you'll work on any paperwork for that. And that way it can get
Yes.
notarized and then filed with the state, and then we can close that out.
Okay.
All right, and then the final topic we had was flu clinics / EDS. Nancy, I don't know if you want to give a quick update on the back and forth regarding flu clinics.
We had not heard anything from Walgreens, so I sent an email out this afternoon and let Karen know. I also did a quick survey of all the town's employees, including the schools. And out of everyone, I only had 12 people who were interested. So we decided Grafton would not do a flu clinic this year.
Yeah, I think
Most
we see,
people
I would say, I mean, we've seen it trending for years now, ever since the CVS's and Walgreens started offering flu vaccines, and they offer them nice and early in like August. Also, that the numbers we've had both from a town / school employee and also then from a more general public side of the world has continued to drop like annually. We've seen those numbers just keep on declining because everyone can easily just pop down to CVS or Walgreens or go to their doctor's office and get them. Whereas back years ago, you didn't really have that type of option as much. So. And then Colleen already mentioned on the school side of things. Dan?
Yeah, just briefly, I think for one reason or another, last year, the primary care physicians and pediatricians were not offering them to the extent that they had been and to the extent that they are now. So that's another avenue that's cut down on the need for the town to do it.
Agreed. All right. Then Dan on the EDS side of the world.
Yeah, that's moving up on my list of to-dos. I'm remiss in getting together with Nancy just to get back to Forrest with the current members and names for the list for our EDS. And hopefully this week sometime I'll get together with her and look at those and take that off our plate.
All right, thank you. The mail and correspondence, we already discussed the feedback Earth situation and their response. So I think we're all set on that. I don't have anything else that came over via email in advance of the meeting for mail or correspondence. So that just leaves upcoming meetings. So we have December 6th and December 27th. Those are the last scheduled 2 meetings for 2021. And then in 2022, so far, we have January 10th, February 7th, and March 7th. Okay. And that was it for tonight's agenda. Dan?
Before I make a motion to adjourn the meeting, I just wanted to see what people think, and we don't have to decide tonight about possibly meeting in person on December 27th if everything stays generally safe. If we're going to be signing, otherwise people may not mind going in individually and signing permits and licenses and stuff, but we might think about talking about that at our next meeting to see if I think we could safely separate and wear a mask perhaps. And on the other hand, I'm not so sure. Well, I guess the municipal center would be open on the 27th, but just something to think about.
Yeah, because I mean, the purpose of that meeting is truly, we've always had that extra meeting to be the signing meeting. It's not usually, unless there was an emergency type situation, we haven't really had any other topics for it. Usually it's just us signing a lot of permits.
But it might be good to get it all done in a half an hour or something like that, as opposed to various trips. Just an idea.
It's a good idea.
With that, I would like to make a motion to adjourn this meeting.
There a second?
This is Bill Muller. I second that motion.
All right. All in favor?
Dan Finn, aye.
Austin Magnan, aye.
Bill Muller, aye.
And Maynard, aye.
Karen Gustowski, Govan, aye.